Welcome to How Now, the podcast where we talk about how to live in the now. And here's your host, Kim Martin Raymond.
Peace and blessings, and welcome to another edition of the How Now podcast, where we talk about how to live in the now. I am your host, Kim Martin Raymond. I am a minister, spiritual life coach. I am an author and founder of Redefining You, LLC, where I help my clients to realign themselves, mind, body, and spirit. And we are back again with another episode entitled Mask Together, America 2. And this is where we're going to be talking about a show that we did not too long ago with our guest, Julie Lamb, where we were talking about mask awareness. And now she is joined with several of her new friends. And it has been a continued movement as we have seen strands of COVID continuing on the rise. We've seen new variants, and we want to make sure that people are continuing to be aware of the importance of wearing masks. So before we dive into this, as is customary with the How Now podcast, I'm going to have my many guests to introduce themselves at this time. And we will start off with Miss Julie.
I'm Julie Lamb from New York City. I'm a writer who loves taking pictures. At the start of the pandemic, I initiated Mask Together America to raise awareness on social media. I take mask portraits of people because I believe each mask portrait represents a voice. I want people to hear us. People need to know that a community of love does exist. We get vaccinated, we wear our masks, we support each other so we can end this pandemic together.
Awesome. Thank you so much, Julie. And we'll talk a little bit more in just a moment. We want to go ahead and get all of our guests introduced here. And next we will have Miss Lindsay.
Hi, I'm Lindsay Schwarz. I'm affiliated with Mask Together America, and I'm here because I am a coronavirus survivor, a daughter of a father lost to COVID. I'm the wife of an essential worker, an airline pilot who is consistently exposed to viruses. And I'm also the mother of a 6- and 8-year-old who are unfortunately going back to school, not under a mask mandate here outside of Atlanta. And I want everybody to know that masking does not have to be a burden and that it's also not political. So thank you for having me here today.
Awesome. Thank you so much for being here with us, Lindsay. Next, we'll hear from Miss Robbie.
Hi, I'm Dr. Robbie Tamargo. I'm a clinical psychologist in private practice in Jacksonville, Florida. I'm a Navy veteran and serve as a consultant to the Naval Hospital Jacksonville and the branch clinic in Mayport. I specialize in treating trauma patients. I am a COVID long hauler. Today is day 453 of being sick. I want to encourage everyone to wear a mask to protect yourselves from the Delta variant, as well as other variants that will come along. I want you to protect our unvaccinated children, and I'm asking you to protect people like me who have become immunocompromised due to COVID-19. I was just hospitalized on Thursday. As you can hear in my voice, I have an upper respiratory infection, and I am very challenged with opportunistic bacterial infections or viral infections that are out there. I was also hospitalized 5 weeks ago for 4 days to receive IV antibiotics for treatment-resistant urinary tract infection.
Wow.
So these are the reasons I'd like to ask you to continue to mask up. It's absolutely not a political decision. It's a public health decision.
Absolutely,
you.
absolutely. Thank you so much for being here with us, Dr. Robbie. Okay, next we'll hear from Mary. You're still on mute, dear.
Hi, I'm Mary Conde. I am from Brooklyn, New York. I am a retired healthcare worker, so I guess you'd have to say I'm kind of an independent contractor. My way of bringing awareness to the COVID-19 pandemic and one of the things that we need to do is for over a year now, I've posted an original mask every day to bring awareness to the importance of mask, or as we called it in the healthcare professional, one of the forms of PPE or personal protective equipment. So the only thing I can do is to remind people to wear a mask, to wear it properly, to cover your nose and your mouth. That's how we can protect everybody.
That's it. Thank you so much for being here with us, Mary. Welcome,
My
welcome.
pleasure. Thank you.
Yes, and next we'll hear from Becky.
Hi, my name is Becky Robertson, and although I wasn't going to show my face because as a COVID long hauler, I am still haunted with various rashes and infections and things, just like Dr. Robbie said, I mean, COVID will just haunt you, but not everyone has a potential to haunt you. And so just like Dr. Robbie, I doing antibiotics, steroids, treatments, what works, what doesn't work. And I'm left like a lot of my cohorts, still fighting an invisible enemy that we seem to diagnose. It's like they keep treating everything, but they don't actually diagnose you. So this seems to go long hauler. It's a lot longer for some than others. So I'm well into the 14th month now. Anyhow, I joined with Julie because I post quite prolifically 24 hours a day, nonstop, latest news, breaking news, whatever's going on. However I could possibly reach people. Some of it, there's a little shock value, but if it helps, that's what I can do. So I work really hard at that. Mask Together America. I've now outfitted all of my doctors and their offices with masks, and it's just a real joy to go in and see them wearing the Mask Together America. It's like, wow, I made a difference, and especially in a doctor's office. But yeah, so that this is really, like Julie, kind of consumed my life, and that's okay. If it saves a few lives, then we're doing what we set out to do. But this is not a time to give up at all. We can't give up. And like the rest of you, sending our kids to school right now, no mask mandate, and ours, I don't know if like yours, Lindsay, but they're not telling the parents. To me, they're doing us a great disservice. And if kids have lice, they tell the family. They're not telling them if they have COVID, and that's scary. It's a really scary situation we're about to go into here. So props to everybody for making a difference. Thank you.
Absolutely. Thank you so much for being here with us today. Okay, next we're going to hear from Rachel.
Hi, I'm Rachel Laiserin from New York City. I'm a volunteer with Mask Together America. Julie kind of inspired me to get involved very early on. It was probably March 2020. I think before there were mask mandates, before I was wearing a mask, she kind of started this effort, and, it really, a lot has changed in the last 15 months. I never would have thought we would be where we are today. It's obviously, it's not always easy to wear a mask. It's not always comfortable, but it is important. And I think where we are today, it's ever more important. I mean, I feel like many people sometimes ready to just stop, tired of it, want to take it off. But when I'm in a public place, I feel it's critical. I protect myself and I protect the people around me, and then it feels like not hard because it's so much more important. What's wearing a mask? A little bit of inconvenience for saving lives. And so I'm very happy to be a part of this. Thank you.
Thank you. It's wonderful to have you here as well. We appreciate you taking time out to be here with us. All right, next we have Helen.
Hello.
Hi, I'm Dr. Helen Pesola, nurse practitioner. Julie and I have been very good friends for a long time. Our kids swam together in the same swim team. So I joined Julie because I work at the Department of Veterans Affairs, New York City, Manhattan campus. I did not get COVID, although I went to work every day taking the subway during the pandemic. I was lucky enough not to get it. However, I took care of my husband, who is an ICU physician who got COVID, and my son, who was asymptomatic. And when we tested the antibodies, he had antibodies. We didn't even know that he got COVID because he was just asymptomatic, except for one day. He did not have a sense of smell and a sense of taste. So that's very interesting. As a healthcare worker and a frontliner, I do believe in the science and the numbers. I have lost many friends in healthcare, families. Recently, my 2 uncles passed away from COVID, and it's not easy for us. In order to eradicate this pandemic, it is really important that everyone gets vaccinated and continue to wear masks. In fact, the CDC recently updated its guidance and recommends fully vaccinated people wear masks indoors and other areas where there is substantial and high transmission rate of COVID-19. And now we have the Delta variant, which is really contagious, and nobody knows what the transmission rate of transmission is. And so I was listening in the news this morning, and they had like over 100,000 cases now. So it is a real pandemic. And it is basically, they're saying that this is a pandemic of the unvaccinated, and therefore we need to protect ourselves. We need to protect our families, the children, especially those under 12 years old, by wearing a mask. So my message is, please help the healthcare system and our heroes by doing your part, getting vaccinated, and continue to wear masks. Thank you very much.
Thank you so much, Dr. Helen. We appreciate you being here with us. I think I've gotten everyone. Did I leave anyone? Nope. I see Miss Katie. Miss Katie, you're up next.
Well, thank you so much, Kim, for having us on. And thank you, Julie, for Masks Together America, putting this together. My name is Katie Marsh. I represent New England Complex Systems Institute in Cambridge, Massachusetts. Work with pandemic expert Yanir Bar-Yam. And we have been trying to convince the nation, the world at large, to go for elimination strategy, to not live with the virus, because of all of the reasons you all just mentioned here and more. We believe that wearing masks and the proper PPE is so essential to keep everyone safe and to bring down the case numbers. But we in fact are hoping that we can get everyone on board to stop this, because we do have the means to do so. It's a matter of deciding to do so. And we are bringing people together through our different networks, such as endcoronavirus.org, and newly started the World Health Network. We just need to really get rid of this virus, and we can do it. And we need to make our voices louder, and we will do that if we band together. So thank you again, Kim, so much for having us on.
Yes, thank you so much. Thank you so much for being here with us, Katie. And then last but not least, Dr. Marge. She is a returning guest here on the How Now podcast. She came on and spoke initially as a long hauler, and she has partnered with Julie, and actually was instrumental in me having the opportunity to meet Julie and to become a part of Masks Together America. So I'm going to let her introduce herself at this time. Dr. Marge.
Well, good afternoon to everybody. I'm Dr. Marjorie Roberts out of Johns Creek, Georgia. I am a COVID survivor, long hauler, advocate, and I am just so happy to be a part of Julie and Julie's vision that she has for the entire world, because the message needs to get out there as I quickly approach my 500 days of COVID-19 and all that has happened to me with my lungs and my liver and the loss of 7 teeth, it is devastating. This virus is devastating. And this virus is no respecter of persons. So being a part of this group, it allows me to do what I can do, which is, and it's so easy, it's just like asking people to wear a mask, because I don't want anybody to go through what I have went through. And now that we have this new variant and it's coming at the kids, as adults, that means we have to step up our game and we have to do everything that we can do to protect these kids, because to have a child have nodules in their lungs and spots on their liver and swollen lymph nodes in their lungs, and to be diagnosed with sarcoidosis, that's hard for me as an adult. So when we come together with Mask Together America, we go after everybody. COVID-19 does not discriminate. So therefore we can't. And now, like I say, that it's coming after the kids, and these kids are going to be going in classrooms where grown people didn't make the right decision. And that's a scary thought. And to just, again, to know that what's going on in my body as an adult could be happening to kids, that we got to step up. We got to do better. So Julie, thank you so very much for everything that you're doing. And Kim, thank you for giving us this platform to be heard. And I just want the world to know that we grown people got to stop playing these games, because the kids are not being given a fair chance. And we were.
That's right. That's right. Well, again, I thank you all so much for being here, for being a part of this movement, for taking time out of your schedules to be here with us. And I just want to say quickly, to piggyback off of what Dr. Marge said, that, this virus has not been, choosy and who gets that, who becomes a victim or becomes touched by this virus. It has touched everyone from the youngest to the oldest, and our children are not able to have as much of a voice, due to, not being able to necessarily, be able to speak out as much as adults have. But we want people to know that, yes, this virus is affecting the children. There are many children that will be starting back to school. I know here in the Atlanta area, children will be starting back to school tomorrow. Teachers have been out and setting up their classrooms to have the children come back in face to face, just like a few of the ladies suggested, with their children. They are not having mandates. I know Lindsay mentioned that as well, that they don't have any mandates for wearing masks. We're talking about the effects of this children being exposed, children that are not of age to receive the vaccination. This is a critical time. And just as Dr. Helen said, with the different variants and the children not being able to be vaccinated under the age of 12, there's a lot of exposure that our children will have. And I know that there are a lot of parents out there who are fearful for their children. So, just when, people were starting to say, okay, I'm okay with it, now there's that fear again that we're going to see a surge in this pandemic. People who are still not willing to take the vaccination, people who are not willing to wear the masks. But it's important for us to see that this pandemic is far from over. We know that we have long haulers who are still experiencing the effects, like Becky and like Dr. Marge. And, it's just been, and I'm sorry, and Robbie as well, that this is it's just something that is not over yet. And we don't want to be remiss and not letting people understand that this is important, this is critical, and just like it was before, this is a critical time for us to continue to raise awareness, to continue to let people know that masking up is important. And with that being said, I definitely want to turn it back over to Julie so she can talk a little bit about what she's been doing with regards to Mask Together America, because the last time we spoke, she was just getting things off the ground. And now I look at all these beautiful faces in front of me and see all of the things that she has accomplished and all of the connections that she's made. And I just want to talk a little bit about what that effort has been like for you, Julie.
We are doing a lot at our end. We are creating a community. The platform, we encourage people to share their true stories. People complain that Facebook is having a lot of misinformation spreading. People are spreading misinformation, so we have to spread truth. Truth will beat all the lies, and that's why we are inviting people to participate in our story sharing, and we are also doing PSA videos, people submitting their video saying that they are vaccinated, and we are standing together. And so we are encouraging everyone to participate in our campaign. So that's how we are moving forward. We are not just promoting universal masking, but we are also encouraging people to get vaccinated. And right now, we are also doing a lot of collaboration. We are supporting our public health community, working with the End Coronavirus organization, the Make Good Together organization, the COVID Survivor for Change, and we also support the Yellow Heart Memorial Group. We want to give people an opportunity to basically share the information together, raise awareness together, to create a community. So it's a lot of work, but it's going to take every one of us to work together. We are also building a website and hoping that we can provide more venues for people to speak up.
Absolutely, and I think that is wonderful. And like I said, just the small representation just goes to show that you have touched people all over this country, and I know all over this world with the many pictures that you have had, that you have taken, the stories that you have shared, the camaraderie. And I think that's so important for people to see that they're not alone in this. We know that this pandemic hit everyone at the same time, and it has affected people in so many different ways. Like you said, we have our long haulers, those who are experiencing things, and you're making sure that their voice is heard as well, and that it's not just those who have lost their lives to it, those who are still living with it. And that's something that I think that a lot of people have not had an opportunity to hear. They hear about people who have had it and have been cured, but it's those long haulers, those who are still suffering the effects. And I know Dr. Marge has been vocal in that as well, because it's almost, when you don't wear the mask, or if you're choosing not to vaccinate yourself, it's as though you're saying that you do not care. And we've heard the buzzword empathy for, that's been the buzzword of the day. Are people showing empathy? Are they caring about their fellow brothers and sisters? Are they willing to take the steps necessary to make sure that we're safe? And so I want to, say again, hats off to the efforts that you've been making and the connections that you've been making and the platform that you're providing, and making sure that people are continuing to be a part of this strong effort. We appreciate that.
I also want to mention one thing is we really need to look out for each other. I myself have never gotten COVID, but I have been doing everything I can to protect myself. I have two immunocompromised kidneys, and I've been working through the pandemic as a photographer in person. I doubled up my mask. I wear two before I got vaccinated. And the minute I can get vaccinated, I got the shots, even though I have side effects, but the side effect will pass. And I get tested for antibodies, and it showed that I have antibodies now. I'm very grateful to have the opportunity to get to be immunized. And we should thank all the scientists for working so hard to make this possible.
Yeah.
And I am a living proof that masks work. I have taken thousands of pictures of people, talking to them with my mask on. Masks have protected me.
Yes.
And so that's a very important thing for people to know. Masks actually can protect you.
That's right.
Not just to protect other people.
Yeah. I mean, and that's important for people to remember too. And I know, Dr. Helen, if you would chime in as well, when we talk about, wearing the mask, even though, people have said, oh, well, I'm vaccinated, I don't need to wear the mask. Tell us a little bit about, why people have felt that that's the case.
Yeah, people probably think because they're vaccinated, they have herd immunity. Not really, because we don't understand so much about this virus yet. It's really the Mask Together America is a platform to continue to raise awareness for people, because we have testimonials of people that mask really works. And in fact, the Department of Veterans Affairs is the first federal agency that mandates all employees to be vaccinated, and we're mandated to wear masks. So that's, that's the science. And people need to believe, because 80% of people who are wearing masks are protecting themselves, their loved ones, and their families. But what happened to the 20% that don't wear masks? So you know what? We're going to let them die?
No.
Because they are not, whether, they have religious beliefs or health issues, but we really have to believe in the science, because the vaccine is working. It is working, and it is protecting us. And continue to wear the mask. The CDC has sent these guidelines last week, because people are now lax because they have the antibodies.
Right.
But people still can get COVID, even if you're vaccinated. However, the signs and symptoms might not be as critical as with somebody who did not get the vaccine. Recently, I had the husband of my good friend in Seattle. He refused to get vaccinated. However, the whole family got vaccinated. They traveled to Dominican Republic for a vacation. And when they came back, they were tested and they were negative. Well, 3 days later, he was the only one who got fever, cough. He was admitted in Seattle, July 14th, and he passed away this Monday.
Oh, wow.
So it really, of COVID. So he was the only one who was unvaccinated, and we lost him.
Yeah.
So it shows that science works, and the message out there is Mask Together America. If you care, you need to wear it.
That's it.
Wear it if you care.
That's it. And you see, it's stories just like these that are important for us to be made aware of, because we think that there are people out here who just think, well, it's just not going to ever happen to me. It's never going to affect me. It's never going to affect my family. It's never going to come into my realm. And we've seen that COVID has touched just about everyone's life, even if it's through 6 degrees of separation. Somebody or somebody that's close to you, or a relative, or a dear friend. We all know someone who has been affected by this pandemic. And so, for us to say, well, it's never going to hit me, so I'm not going to worry about it, we're remiss in doing that. And you talk about like I said, the importance again of wearing the mask. And I think about Lindsay and talking about your children getting ready to start school. I know you're here in the Atlanta area as I am, and it's school starting back tomorrow, and how scary it can be that they're not doing mask mandates. And our children who are under the age of 12 are not eligible for vaccination. So as a parent, I mean, I'm sure that has been hard for you, and then also in losing a loved one in your own family. And my condolences again on the loss of your father. But just, knowing that you have a husband who is an essential worker, who is out there, who is helping to fight, how has it been for you as a person who has experienced it on many different levels?
Well, thank you for giving me the chance to speak on that. In the beginning of the pandemic, it was especially terrifying. My husband is an airline pilot, and he flew consistently to New York City, to Newark, JFK, LaGuardia, before anybody was wearing masks or anybody really knew what was going on. That was very scary. Despite his service in that regard, he was furloughed for 9 months. In the space of that time, I lost my father, who was a physician and did follow protocols, but sometimes that happens, and he unfortunately got it. I contracted COVID while taking care of him before he was hospitalized. And I'll say the trauma of having to walk around, deal with this virus, knowing that it killed my father, has been very hard to deal with. I'm concerned about the mental health effects that will have on my children. Yes. Also, because they see many of their friends running around without masks on at various places. I've had to really reiterate to them that we lost grandpa, and they missed their grandfather. They were close to him. He had just moved here to be near us. So I have to remind them of that, to remind them to keep the mask on their nose, which I think is not only important for kids, but for adults, because not everyone does that. I don't know if the other kids in their class are going to wear masks. I doesn't look like a lot of them will. So it's a constant fear. And what I'd like to say about the kids is, I'm not a doctor, so anybody please correct me. But while it is a small percentage of children who will have severe effects from COVID, and the statistics say that it's more dangerous for a child to ride in a car or swim in a pool or possibly drown than to have severe effects from COVID. Wow. This is now an added risk for children that we've added on to the other list of things that we expect our children to possibly have a problem with. So this is not anything to laugh at when it comes to children. It does affect children. Children have ended up on ventilators and with long-term effects, and that is not what I want for my children or any child I see. And I encourage school systems to think about that and listen to the American Academy of Pediatrics and the CDC recommendations.
Absolutely, absolutely. And again, that's why it's important to have platforms like these, because there are some people who still are not aware, even though this is an age of technology and information, there are still those who refuse to seek the information. They're just waiting to hear from a friend of a friend. And if they have friends who are not willing to, be to advocate for wearing masks, or they don't believe in going about having a vaccination, then, that's their only source. And they may not be doing anything because they're just not aware, or they have not heard of stories, that they have not had it affect them directly. And it's unfortunate that sometimes that's the only people that we hear from, those who are closest to us. And if the people closest to us don't believe in the vaccination or the mask, then we're losing those people as well. So I thank you, Lindsay, for bringing that to our attention. Also, I wanted to talk to Becky a little bit, and this is for Becky also and for Dr. Marge, because I know that as long haulers and some of the effects that you've had, I know that it's difficult, for you to see people who, who may know you, and may have is to be in contact with you, and they choose not to vaccinate or to wear masks as well, even after seeing the effects.
If I can just jump in, that one of the things I think that hurts my feelings or any long hauler's feelings the most is, number one, you look fine. People still call it cold and flu, nothing more. I've never known of a cold or flu to have effects and impact the entire body, head to toe, from brain to heart, lungs, vascular system, skin. This attacks every single organ, and it's very frustrating because a lot of people I love and care about that are in my world don't take it seriously. To me, and that's a front to me. I mean, you've seen me struggle and suffer for all of these months, and you still think this is a joke, that it has something to do with some wild conspiracy. And I get them daily, every day, a new conspiracy theory. And I can't entertain it. And I don't want to not have a relationship with these people. But right now, we are in the toughest part of this pandemic, and every decision that we make right now is going to dictate how this is going to play out. So the more people that are not vaxxed, the more chances we're going to have mutations. Delta's scary. There are other variants out there that are more scary, and ones that we may create and have homegrown here in the United States, and that's definitely not something I want. It's herd immunity, I don't think is necessarily a possibility, but we can stave this off so that we don't have any more mutations. Schools are going to be a challenge, and that breaks my heart for all of us parents, because many of us,
educators as well.
Yeah, exactly. And I was a teacher, and to be honest with you, there's no way in this planet I would never teach now, and they're recruiting left and right. Wow. But I mean, I've seen it. I watched last year, and it was kind of our fun hobby, and it really was not fun. But my daughter would go, "Mom, come here, the teacher's not wearing a mask, and there's a student right next to him not wearing a mask," while we had a mask mandate. And so I kept taking pictures. And when the principal said, "Why don't you want to send your kid back here to school it's so safe?" And I pulled out my camera, and I'm like, well, this teacher and then this kid right here and all these people, I don't want my child to be a part of that. I just don't. I mean, can we afford to do it? I mean, you make it work. I mean, these are our children, and people are going to judge, but to me, it's very important. Also, my daughter had COVID, I guess you could say twice, one symptomatically and one asymptomatically. She got off a plane from Chicago and brought it back, and then that was my second round. But she was asymptomatic. Nobody knew any better, and of course, everyone, "No, you don't look sick, so you're not sick." But she was sitting there. I mean, I had to contact the airlines, and the airline said, "Nobody does this. Nobody actually calls," which breaks my heart. I mean, we need to take an active stance. And if you know somebody who's exposed, please, encourage them to do the right thing. I have way too many friends that are not getting tested. When they go to get tested, and this happened to me recently with a crazy rash I had, and they said, "I'm sorry, we don't test the vaccinated. We just don't do it." So all of this, lack of transparency is not helping anyone really, and it's not helping the parents to make a decision. But I mean, it's a simple, tiny, kind act, just to show that you care. We're not asking, for your firstborn. We're just asking that you use a few mitigation measures. It's really not difficult.
Right. Thank you for sharing that, and that's important for people to hear, because you get a lot of that, or you don't look sick, and there's nothing wrong with you. And I know Dr. Marsh can speak to that as well, because I know that you had a lot of naysayers when you were first contracted with the virus as well. So talk a little bit about that, and then I want to hop into Dr. Robi, because I want to ask her, as a clinical psychologist, to talk to us a little bit about that as well. But we'll let Dr. Marsh start first.
Yeah, this whole thing has changed my life because prior to COVID, I've always been a people person. And now I have to pick and choose, and I've lost a lot of friends, and that's okay. And I just can't be beat up anymore because I got picked on and told I was faking and called a liar and called a sheep and, you know, an attention seeker and all those things. And it just got to the point where I just made up in my mind, no more. So I did a lot of unfollowing. I did a lot of blocking. I did a lot of deleting. And even in my own family, you know, I had to pick and choose. I had to choose me. And I just narrowed it down to my immediate family because my oldest sister is 81 years old. And I just went after her kids and, you know, all of my older sisters. I just went after their kids to make them understand that you guys got to do everything you can to protect my sister. So in my immediate family, it's good. You know, like I say, I lost a lot of people, but I also gained a lot of people because I didn't ask for this thing. I was doing everything that society told me to do because I was getting ready for retirement. I was getting ready to make that transition into semi-early retirement, my husband and I. So to be dealt this hand, I can't heal myself physically, but mentally I work on myself every day. So it is hard, you know, when people tell me all the time, well, you look fine. And I say, that's because I had health insurance and I was able to get these new teeth. But the reality is I lost 7 teeth to COVID. So, you know, looks can be deceiving.
That's right.
Looks can be deceiving. All of us, you know, yeah, we look good. But once this camera go off and the lights go off and everything go off, then, you know, we just normal people. I got being gay on my nightstand, Vicks Vapor Rub on my nightstand, all these things, you know, so it's nothing glorious, but we thankful. So Kim, thank you so much and for helping us tell the truth.
Yeah, because the truth needs to be told. Okay, like I said, I want to have Dr. Robbie chime in here. I know that, you know, as a long hauler yourself, but also as a clinical psychologist, there's a lot more that goes along with this psychologically. So can you talk a little bit to that?
Absolutely. A lot of people aren't aware of the neurologic impacts of COVID. And it's really quite profound. And it's because COVID is really a vascular disease. And obviously our blood vessels run throughout all of our bodies, and that's why we're having so many different organ systems involved. But the neurological aspect is really quite profound. One of the things that it does is it alters our neurochemistry. And in doing that, some long haulers are experiencing depression and anxiety for the first times in their lives. Clinical depression, clinical anxiety, and people who have a history of battling either of those are finding an exacerbation of that, and sometimes the worst that they've ever felt in their lives from a mental health standpoint. All of us are on support groups together, and thank goodness for our support groups, because we have lost fellow long haulers to suicide because they have not been able to win the battle. And as they're getting into the 400, 500 days of being ill, it's worn on them and they're completely hopeless. And that breaks my heart as a psychologist. And I've tried to share information about the suicide hotline that's available. It's 1-800-273-TALK, as well as the crisis text line. And it literally is crisistextline.com. And they're available 24 hours a day, 7 days a week. And so people need to know there is hope. And there are treatments becoming available. I want people to be aware of that. I'm actually in an experimental treatment protocol right now. And before I got this infection this past week, I did not sound like this. I sounded like myself. I was looking good. And so I'm 4 weeks into the treatment protocol, and the treatment docs were so thankful that I was on the treatment protocol when I got this so that I didn't worsen. But the other mental health aspect, several people have talked about this, but I'm going to give you the medical terminology for it.
Mm-hmm.
It's gaslighting.
Yes.
And we're seeing medical gaslighting, we're seeing community gaslighting, and we're seeing family and friends gaslighting, and employers gaslighting.
Yeah.
And more and more, now that the CDC has recognized COVID long haulers, and additional organizations are becoming aware of this phenomenon now, people are starting to pay attention. But I have, I'll just use her first name. Her first name is Candace. She lives in Atlanta, and she had to go to the hospital last week. And actually, it was while I was in the hospital, she sent me a voice clip. And I encouraged her to post it. She recorded her experience with the doctor in the ER.
Wow.
And he came in without a mask on. And then to cut to the end of it, he got upset with her because she asked him, would he put a mask on? And he left and came back, still no mask. And she asked him again. And he finally said, I'm sorry, I can't treat you. And told her to make a new appointment and see someone else because he couldn't see her because he couldn't handle that. And I heard the entire message, and she was very polite. And I'm seeing some others who know who I'm talking about, probably have heard it as well. And she was very polite. And this medical provider was just so out of line. So we all of us, as we continue to battle this, and we have multi-system organs involved. If you're not, I'm being treated at Mount Sinai Center for Post-COVID Care. So I'm at the premier treatment center in the United States. And so I don't face this anymore. But when I was in Florida, I faced this, and I'm a doctor. And I was too sick to be able to do what Candace did and speak up for myself. I was just too ill.
Right.
But this issue is traumatizing people on a regular basis, as well as obviously being a long hauler, as well as even having COVID. And there are people who are long haulers that don't know they're long haulers because they're well. And then 6 months later, they get something.
Right.
So
just like you said, it's important. It's important, like you said, for masks, even for those who are long haulers who have experienced things, because it's like you said, there are some things that are not happening right, immediately, and they're seeing things that are developing down the line. And so it's important to remember that. But the statement that you make about gaslighting is something that's so critical. It's something that we're seeing a lot of, and on so many different levels. And so I'm glad you brought that to our attention, because that's something else that we need to just continue to have a conversation about, because it is not just physical, it is mental, it is psychological, it is emotional. It hits on so many different levels that it's important for us to remember those things. And when we talk about wearing our masks, we're talking about connecting, to all of those things. We're wanting to help to avoid any aspect of COVID on any of those levels for coming up. Now, I know we're getting close to the end of our show, but I want to give Rachel and Mary an opportunity to speak as well. And we'll start with Mary first, because I know she is a healthcare worker as well. And also just all of the wonderful masks that we've seen her wearing day by day. Those who have had an opportunity to connect with Mask Together America have seen her picture and have seen her wearing various masks that have just been beautiful and have helped in promoting. And so, I was happy to get on and say, I know Mary, because I see her face with all those lovely masks on. But just to give you an opportunity, Mary, to chime in and talk about the experiences that you've had even as an essential worker. There we go.
You know, I guess for me, it was seeing my fellow employees have to get sick themselves. Some of my fellow employees having passed away, understanding what the physicians were going through as they were treating these patients, as every bed in our facility was an ICU bed. The ambulatory surgery unit, the psych unit, everything was ICU. And so the intensity at which everyone fought to take care of these patients, the sadness that was experienced for those patients who did not make it. And the only thing that I could really do was keep other people safe by wearing a mask. And I guess it all started as I was just trying to make a horrible situation, just do the best that I could to help the situation in some way. And the only thing I could think of was just show a mask, match it to your outfit of the day, you know, just do it that way. And so I've kind of termed myself Queen of the Mask, and it's not,
Right.
it's, you know, it's, and it, maybe it's a terrible thing to say, but it's really the only way that I can get people to understand that wearing a mask and wearing a mask properly is something that everybody can do.
That's right.
And it doesn't take a lot. It doesn't take a lot. So that's really, you know, what I'm doing. And you know, Julie asking me to become a part of Mask Together America, I kind of slid right in the name of the group, Mask Together. So I'm grateful to be part of that. And if I am making someone understand the importance of wearing a mask to protect themselves, even though I'm vaccinated, I could still
That's
carry
right.
the virus and
That's
spread it.
right.
And
That's
I
right.
don't want to do that. So I will wear the mask for as long as is needed.
That's right. We appreciate that. I appreciate that. And like I said, I love it. As a fashionista myself, I like to have mine match. So every time I look at it, I'm like, yes, I love it. So absolutely. Even for those who are who just, you know, just think, oh, it's not going to match my outfits. It
doesn't matter.
Just the fact that you're wearing it.
Yeah. Get
and
a
that
blue
there's an
disposable
opportunity
mask.
you can wear them
It's all good.
anyhow. There are so many styles and so many ways. So you can't say, well, it's this mask. I don't like this one. I don't like that one. There are so many to choose from. So it's like, but it's important just to remember to wear it. Just
Correct.
to wear it. That's the key.
I tell people you show someone you love them if you give them a mask.
That's right. That's right. That's the best gift that you can give people. Think about that. That's a good segue into you know, the holiday season coming up. Get somebody a mask. Give them a Christmas one. Get them one for Thanksgiving. Get them one for any other holiday that they celebrate. You know, make sure that it's just something, you know, for those who are younger. Make it something fun for them, but also make sure that you tell them the importance, that you tell the story, that people understand why. As children, we always, you know, when we were children, we always asked why. Tell people why. Why is it important to wear this mask? What have you experienced? That's why we're sharing so many of these stories today, because we want people to understand this is why it's important. These are the faces of people who have been affected by it, you know, including myself. I have my husband was vaccinated and he contracted COVID as well. And he is a cancer survivor as well. And so there are just so many reasons why it's important for us to wear masks for us. You know, so I make sure that I'm not bringing home things to my 3-year-old grandbaby,
right?
You know, who can't protect herself, you know, so we have a role and we have a responsibility. And we'll wrap things up with Rachel. I want to give her an opportunity to chime in and you know, because there's so much that we all are doing, you know, to be a part of this, you know, of this effort, you know, and I want to talk a little bit more about what it is that you're doing to help as well.
Thanks. I mean, these stories, hearing everyone's stories kind of all at the same time, you know, they just kind of show the breadth of the impact of COVID-19 has had, you know, whether you've lost someone or you're dealing with family members who are sick or worried about the safety of going into your office. And I think one of the things that we didn't really touch on is the other thing is that I don't want to go back into lockdown. I don't want to go back to that place where, you know, I'm afraid to leave my house and I can't even go shopping and I hear sirens screaming past, you know, my door. We can't go back there. You know, I want my children to be in school. I want to be able to go to the office. And the way I can do those things is by wearing a mask. And that's such a small thing compared to like the freedom and that we need, and the ability to be able to connect with people and interact with the world. And if we can do that, and all it takes is wearing a mask, I want to support that. And so that's why I'm, happy to just continue to be a part of this. Really, really appreciative of Julie and all the amazing things she's done with Mask Together America, and all the amazing people, kind of that have connected through this kind of movement. It's a small thing, but it can really change lives, so many lives, and it's really important.
Right. And I thank you for that, because that's something that people haven't thought a lot about. If we don't, do those things that we talk about doing, if we stop, wearing masks or not doing the pandemic, and we see this uptick, we see this rise, we see these new variants, we'll be right back in the same place where we were, behind doors, not able to come out and do things that we want to do, and to be able to congregate and to be able to see family members outside of Zoom and other types of social media that have kept us together. We want to be able to move past that, and we can't do that if we're not willing to take the steps necessary to make that happen. So Rachel, you touched on a very, very key part, and that's a wonderful way to wrap up this conversation, and saying that we want to do this so that we don't have to be confined to our homes, and that we'll have opportunities to come together and to do some of the things that we want to do to reconnect with the people who are near and dear to us. We have many people who have lost lives and have not been able to be, to attend their memorials. And that's been a very difficult thing for a lot of people. And there are still people who are feeling the effects of that, and not being able to have that closure with their families or with their loved ones on a daily basis. And so it's important that we continue to mask together, that we continue to join forces, that we continue to educate people so that they understand the importance of what it means to bond together, so that we're getting to a place of healing, that we're getting to a place of knowledge. And as we're learning more about this and able to find different types of vaccinations and things that may help to heal, what else can we do just to be a part of the solution, to be a part of helping, to be a part of being empathetic to those who are dealing with it, those who have lost loved ones, those who are still dealing with the effects, and those who have not yet experienced it. But we know that it's important for us, again, to mask together. So I'm going to leave the last words to you, Julie, your last words for, everyone out there, and what they can do to be a part of Mask Together America.
Got it.
I want to remind everyone that the nationwide trends right now is showing 18 to 49 make up the largest demographic of hospitalized COVID patients. Yeah. That's alarming. Moving forward, we really need to encourage young people to mask up. We are seeking more collaboration with organizations that promote mass awareness and also vaccination. We're hoping that we can collaborate with universities and send a stronger message together. Right now, we are working with some student organizations as well. SF Strong and also Where If You Care, they are student organizations in Michigan and San Francisco. So that's the direction we're moving forward to. And we're also collaborating with Long COVID Kids USA, looking for more partnerships to send messages together.
Yeah.
We have to stop Delta variant and all the other variants. So wearing our mask is very critical.
Yes. Well, like I said, I want to take this moment to thank you all for being here. I see we had one guest who came on at the last moment, and we'll give him a moment just to to chime in and tell us who he is and your organization. Yeah, you're on mute, dear.
Thank you, and I'm sorry. My apologies for being late.
That's all right.
I'm from GiveMassAchance.org. The main purpose that we started the organization for must be about a year ago or maybe longer, was with the hopes of creating a song. And the song is Give Mass a Chance. And it's taken actually from a very old song of the Beatles. And I rewrote the lyrics to Give Peace a Chance.
Yeah.
And it's gotten some exposure, not as much as we would have wished it had. And now I'm working with Julie at the present time as well as on my organization. And I think we're at a very critical point with what you all spoke of, the idea of binding together, the idea of where we should go next, the idea of what have we done? You know, we really can't measure what we've done. We all know that we've helped save lives. We've helped people prevent themselves from being long haulers. But now is also the incidence of the low vaccine rate that we have. Mm-hmm. And I think it's important to examine where our best efforts can be put. Is it in getting more people vaccinated? Is it in encouraging mass? Is it both? And in what direction we should push? Should we be lobbying, you know, the common citizen? Or I don't see, unfortunately, that the political and financial aspects have taken a second share to the actual virus and the people being injured and killed by it. I see it as one which is very politically and financially driven. And unfortunately, that hasn't changed from, not that we should talk politics, but that really hasn't changed from Trump to Biden. That really hasn't changed from CDC working under Trump or working under Biden, or the Surgeon General working under either of them, that we're still left with this terrible void in what our government is doing and what the science is and isn't telling us, and the flip-flop that we're experiencing is worse than ever.
Yeah, well, like I said, we thank you for being here and joining us and talking about your efforts as well, and GiveMassAchance.org. But I'd like to take the time to thank you all for being here with me, for sharing your stories, and for, you know, the thoughts that you've shared, just for opening the doors, opening the eyes, opening the ears to people who may not have heard the stories, who may not have thought about wearing masks, and may, you know, by the words that we said and the stories that we shared, thought to say, okay, you know what, you know, maybe it's time for us to mask up. You know, maybe it's time for us to do that. So before we go, I want us to put our masks back on if we have them nearby, because we practice what we preach. And it's all about masking up. And we want to make sure that everyone masks together, and that we mask together, you know, for everyone, not just for ourselves, for our families, but for each and every person represented out there. Okay, so remember, mask up, America, mask together, America. Be a part of the movement, and we'll make sure to have the contact information for each guest who was here on the show with us. And that will do it for this edition of the How Now podcast, where we talk about how to live in the now. And until we see you the next time, give them the peace sign, everyone. We say peace.